Morning mofos. So have you seen another healthcare practitioner and been disappointed with the lack of hands-on treatment you've been given? So that's what we're going to talk about this morning. So there's a bit of a backdrop to that. This isn't us slamming other healthcare professions. This is us trying to explain perhaps why you get a different experience when you go and see somebody else as opposed to when you come and see one of the guys at Mofo. Now, other healthcare, we're all, as healthcare practitioners, osteopaths, chiropractors, I think chiropractors are bounded by the same
code of conduct.
Yeah. Physios, we're all bound by something called evidence-based practice. And evidence-based practice is the use of research, patient goals and expectations, and your experience as a clinician to inform your clinical decision making. So what do you do in terms of how do you treat your bad shoulder, how do you treat your poorly hip, how do you treat your bad back? Now, according to the evidence, and I think this is where the evidence falls flat, there's very little evidence to support the use of soft tissue work, manipulations, mobilisations, and that's simply because I just don't think we know what we're measuring. I've run experiments, I've run various research projects at university, my role as a lecturer, and it's incredibly difficult to control for all the variables that are going to impact your results. If you think about the sort of the soft tissue work, something as simple as a massage, from one practitioner to the next, there's going to be very different techniques, there's going to be different pressures. If we're talking on a sort of woo-woo scale, there's going to be different levels of interaction between that client and the patient.
You wanted to say exchange of energy, didn't you?
I did want to say.
You did want to say that.
I was waiting for the backlash of people going, exchange of energy, you're a quack. So it's incredibly difficult to know from that one treatment what you should be measuring. Should be measuring things in the blood, an immune response.
I don't even think we understand a lot of what we should be measuring. We don't know what changes are occurring, so how can we measure what we don't understand?
So I think when it comes to the evidence to support these things, I think as a researcher, it's incredibly difficult to know what it is that you're measuring. When you think about things like spinal manipulations, which are over in a second, we don't yet have the sophisticated technology to be able to catch that event. And again, I think that means it's impossible for us to say what that does.
Which leads to a lack of evidence.
And I think, practitioners, newly qualified practitioners, I think those people just coming out of university, because they have little clinical experience, because when you see patients for the first time, you're shitting yourself, not wanting to fuck up. I think you tend to rely more heavily on the evidence, and the evidence is firmly in the camp of, movements, exercise prescription, etc., etc. Now, I've been doing this long enough now. I'm 27 years, I think, been working as a therapist.
Yeah.
And we see in excess of 250 clients a week.
Yeah, at least.
So 250 clients a week, multiplied by 12, multiplied by 27, that's a lot of clients. That's a big randomised control trial. And, I think I'm not arrogant enough to think that it's my treatment that fixes people. I think what we're doing with our hands is we are calming down the nervous system, we're reducing the pain experience of the patient, we're giving them some hope that, well, if he can reduce my pain that quickly, then there's no reason why I can't be pain free.
So it's therapeutic.
So maybe it isn't, maybe the benefit isn't in the laying of enough hands and the transfer of energy. Maybe it's the fact that you're giving people confidence, hope, empowering them into approaching and adopting a movement-based approach to their recovery.
And people want you to understand what they're feeling, so when you press a certain point and you say, is that where it hurts? And they say yes, it
kind of
legitimises the pain for them.
So, to all those evidence-based zealots out there, this isn't me knocking evidence-based practice, because I am very much an evidence-based practitioner. But my Venn diagram, that's those little circles, is much bigger in my clinical experience and much bigger in my patient goals and expectations boxes than it is in my use of research, because I just don't think research science yet is sophisticated enough to catch much of what happens in a therapeutic encounter between a practitioner and a patient.